Do you suffer with heel pain or plantar fasciitis? Are you struggling with generalized foot pain and don't know what to do? Have you tried orthotics and they're not working for you? Make sure you check out this video. I've got some really helpful tips on how we can help you with your heel pain and plantar fasciitis, how you can address the underlying cause of it long term, how you can avoid orthotics, being stuck in lace up shoes, go barefoot over summer, pain free. My name is Daniel Fitzpatrick from Sydney Foot Solutions, and we successfully treat heel pain and plantar fasciitis all the time. We do it without having to use orthotics, and we see stacks and stacks and stacks of it. In fact, we see probably about 100 cases of heel pain and plantar fasciitis a week. And what I'm going to go through today is a recent success story that we've had. I'm going to show you the exercises that we used for this particular person. I'm going to take you through the process on how you can address the underlying cause of your heel pain and plantar fasciitis without being reliant on drugs, without being reliant on footwear, and without being reliant on orthotics. So I just want to share with you a recent patient story that we had. This particular person came in to see us. She already had orthotics. She was getting very, very frustrated. She couldn't walk. Needless to say, she was getting very, very frustrated that she couldn't enjoy her lifestyle down at Manly. And she was suffering with heel pain quite extensively. And it was really holding her back. So she came to see us. She was particularly attracted to our treatment process because we do advertise the fact that we can treat without orthotics. I'm not saying orthotics are bad, but we do offer an alternative to orthotics. So she was pretty into that, given she lived near the beach and she doesn't want to be stuck in, lace up footwear all the time. She came to see us. She had had the pain for at least 6 months at this stage. It was fairly significant to the point where it was restricting her activity and her exercise. So she came in to see us. We did an assessment. We did a weight-bearing X-ray, which allows us to actually measure the level of misalignment in her foot. It also allowed us to diagnose where the underlying cause is coming from of the heel pain and plantar fasciitis. And we started a course of manual therapy with her. And so what that is that it's a gentle hands-on technique where we work on correcting the level of alignment, and then we give the patient exercise to support those changes. And we're going to show you those exercises that we gave her in this video today. So make sure you stay tuned. We also combined it with our fancy lasers. So we have two sort of high-powered lasers here. The lasers don't hurt or anything like that. What they do is that they speed up healing, they accelerate reproduction, and they also reduce inflammatory response very, very quickly, but they help enormously with pain. So needless to say, we've had the huge advantage that when we're treating someone, we can really stimulate that healing and that pain reduction. And the great thing is we don't have to interfere with activity. So if you do have a flare-up, we can use the lasers to settle you back down again without you being reliant on anti-inflammatories or cortisone or nasty things like that. So definitely, needless to say, over the course of the treatment, she continued exercising. We didn't restrict her activity. And over an 8-week process, we saw a significant improvement in her heel pain and plantar fasciitis. Needless to say, we've just recently finished up her treatment and she's on the right track. She's got her exercises and she's well and truly back into activity and doing the things that she loves, walking along Manly Beach. So what I would say is that real success story. We do see this all the time. In fact, we see over 100 cases a week of heel pain and plantar fasciitis. We're sort of experts in this field, so to speak, and we have done for a long time. In fact, over 20 years, sadly, because that reflects my age. So what I would say is that just be aware there's lots you can do for heel pain and plantar fasciitis, and we get success with it all the time, and you don't have to be stuck in orthotics. If you would like individual advice for your plantar fasciitis, keep in mind in the link below this video, we have a 60% off initial foot pain assessment offer. It's just $40 and you can come in and get individualized advice for your foot pain so that we can help you. So back to the exercise that we gave this particular lady. I'm going to show you the first one. So the first one is the dowel exercise. So this is a wonderful exercise for plantar fasciitis. What it actually does, if you're wondering, is it breaks up the tightness underneath your foot and actually really accelerates healing through that area. So you won't like this when you first do it, and it does hurt, but it's very effective. What research has shown us is that it helps to proliferate the cell growth through the plantar fascia, and you actually end up with stronger, thicker fascia for the rest of your life. Fascia loves tough love. You don't, but it does. All right, so the way we do this one is get yourself a stick or a broomstick or something like that. I've got just a little piece of dowel there, and then you walk along it. And when you hit a sore spot, 1, 2, 3, 4. Stop for 4 seconds. 1, 2, 3, 4. 1, 2, 3, 4. Just like that. And it just breaks up that tightness underneath that area and helps to really proliferate that cell production. Hugely beneficial. So really great one to do. Be aware that you will be very tender with that. If it's too tender, 2 feet, maybe try 1 foot at a time and then build up to 2 feet. But a really, really, really great exercise for that. Definitely one of the most well-researched and well-proven exercises that I have seen. And so that's about loosening your fascia and proliferating the cell growth. Now we want to start strengthening through your foot and ankle, because often part of the reason that you have plantar fasciitis is because some of the supporting muscles aren't doing their job. So the way we do this one is we get yourself a towel and we flex your toes, and then we go down, 1, 2, 3, then up, 1, 2, 3. Just that. And what that's doing is it's strengthening through your ankle and your arch and really building up all of those tissues through that area. So it's really, really important you to use the towel. Now, the reason is because if you flex the toe, it turns on all of your arch and your ankle muscles. If you don't use the towel, it doesn't work as effectively and it's not as good. So I strongly encourage you to use the towel. Up and down 10 times, start 2 feet. And then as you get stronger, then you can progress to 1 foot. And I'll demonstrate how you do 1 foot now. So here we are, 2 feet, up, down, and here we are, 1 foot. And you notice that I'm going past 90 degrees and really loosening up and stretching out all those tissues. So the great thing about this exercise is it stretches, it strengthens, and it actually builds up all those tissues. It improves the way you stand, the way you walk, and helps to address the underlying cause of why you get the plantar fasciitis in the first place. So I hope this video was helpful. Please feel free to click on the link below if you'd like to get your foot checked for 60% off. Also, if you like the video, please like the video. Feel free to subscribe to our channel. We try and produce lots of helpful content, which will help with your foot and general health overall. And I hope this was helpful. Please let us know if we can help with anything else. Feel free to comment in the link below.